Hello and welcome to another episode of Tuesdays with a Disability Policy for All. Today I have the great fortune to interview Katy Neas, who is the Deputy Assistant Secretary of the U.S. Department of Education OSERS program, and she's also a friend of mine. The mission of the OSERS department is to improve early childhood educational employment opportunity and to raise expectation for all people with disability, their families, and the community and the U.S. Today we're going to be talking about what OSERS does and what Katy does to improve employment opportunities after education. And I should also describe myself for our viewers. I'm a short woman with glasses and brownish black hair, and I'm wearing a blue turtleneck. And Katy, can you do the same thing?
I sure can, Liz. I am a middle-aged white woman with brown hair pulled back. I'm wearing a black jacket and a white scarf, and I'm very happy to be with you today.
Thank you, Katy. My first question is, what are your thoughts about the ADA and how far we have came since then?
Sure. For me, the ADA represents everything that's good about our country. The ADA was always about people with different perspectives coming together to shape a solution for a common problem. That discrimination on the basis of disability was wrong and needed to be illegal. I think since in the 33 years since the ADA was enacted, I think we've made tremendous progress, particularly in physical access. We know that new construction needs to be accessible. And so if there's a new restaurant or a new movie theater or a new office building, we know that the physical needs of people with disabilities will have been on the forefront in the design and construction of that building. And I think that is tremendous progress. I think one of the things that's important to remember is the internet wasn't around in 1990. We couldn't have done this. And so the progress we've made in communication and web access is great, but I think there's a tremendous amount of work that remains to be done to make sure that every person can use every tool, access every website, and communicate with their friends and families in every way. And I think that progress is coming, but we're not there yet.
Thank you. As you might know, this show is mostly for people with disability or people who might not understand about legislation. So the two words that you said that might be confusing to people is enactment and tremendous.
Sure. So enactment, when a law is enacted, that means that that Congress has voted to approve it, and then the president has signed it into law. So enactment means when Congress takes action and passes a bill, and then once that bill is passed, they send it to the president and the president signs it. And tremendous is, this is very helpful to me. Tremendous is just a big word for a lot. And so when we made tremendous progress, it means we made a lot of progress. And I hope that helps.
Okay, thank you. And it does. The next question is, what does OSERS doing to improve employment opportunity for people with disabilities?
So I've been here about 2.5 years, and in that time, we've launched two big initiatives. One was designed to help those states that currently have a large number of people with disabilities who are working at sub-minimum wage. And it was grants to those states to help them make sure that few people go into sub-minimum wage jobs, and those that are in can transition to something else. And we've got grants in 14 states to do that, and we hope to see progress there. The other big initiative that we just launched was grants to about 20 states to help them improve school to work transition services. We know that more than half of all students in special education are not receiving pre-employment transition services when they all should be. And so our grants are designed to help schools and vocational rehabilitation agencies and centers for independent living to work together to try to make sure that kids with disabilities are leaving high school having had access to internships and to try new things and to explore what they might want to do once school is over. So we're hoping to see progress in that area as well. And we know that there's a lot more work to do, but those are two of the big things we've been working on since I've been here at the department.
Thank you. And I think when people say sub-minimum wage, they might often know of it as 14 cities.
Right.
What do you go for OSERS during your time there, and what current projects you're working on to improve the transitioning to college or career? And I think you have mentioned some of them.
Sure. So one of the things, in addition to working on special education and vocational rehabilitation programs, is I am also the department's lead staff on trying to address the youth mental health crisis. Right now, suicide is the second leading cause of death for kids between the ages of 10 and 24. That's very scary to me. But we've been working to increase the number of school-based mental health professionals, people like school counselors and school psychologists and school social workers. And we've also been working to try to make it easier for schools to access the Medicaid program to pay for mental health services for kids. And it's not just kids with disabilities, but it's kids with disabilities and all other kids. And one of the reasons the Department of Education is so engaged in mental health work is that the research is very clear that children who experience unaddressed mental health problems, meaning kids who have mental health problems and they don't get the help that they need, are likely to face problems going in their daily life. They're likely to have poor grades. They're likely to be absent from school. They may have to repeat a grade. They aren't going to do as well in school as if they didn't have these mental health concerns. And so we want to make sure that school can be a place where all kids can get the mental health supports that they need or be connected to it so that they can be successful in their schoolwork. And so that's one of the other things I've been working on. And it's something that we've been working with other people in the federal government, trying to make sure that we're doing everything we can to support all people to have access to the mental health supports that they need. We know that the pandemic was hard on a lot of people, and things that were hard before the pandemic didn't get better during the pandemic. And we're still trying to get back to a point where people are happy and healthy and able to do the things that they need to do to live their lives, and making sure that they have access to somebody to talk to, a friend, a neighbor, a professional, is one of the things that we're working very hard to make real for everybody.
Thank you. And a follow-up question is, with your emphasis, with your involvement with mental health, is that had to do with being bullied? For example, I was bullied in school, and when I got home, I would cry, and I had my parents to talk to, or my sisters to talk to, but I wonder whether a lot of people might not have those people in their lives.
That's exactly right. I have a fair amount of experience with bullying as a parent. My daughter was horribly bullied in elementary school and horribly bullied in high school. And we were able to get her the help she needed to learn how to protect herself. But we were lucky. We had insurance. We found a good counselor. Not everybody has that ability. And that's one of the reasons why we wanted to make school a place where kids know that there is somebody there who is looking out for them, who's going to help them, who's going to protect them from bullies and other bad behavior. Because we want school to be a place for kids feel safe and supported and welcomed. And that's hard for a lot of kids, and kids that we don't want kids. One of the things that we're hearing from a lot of parents is that their kids are afraid to go to school, and they won't go to school, and they're afraid for a bunch of reasons, but bullying is one of the major reasons that they're afraid to go to school. And we just can't we need school to be a safe place for everybody.
Thank you. What progress do you see with your current work compared to progress made with the ADA?
Sure. One of the reasons I've loved being in the disability policy field for as long as I have is that disability policy can and still is bipartisan in many ways. Republicans have disabilities, Democrats have disabilities, independents have disabilities. And we really need to continue to try to find those places where we can all agree on what we need to do to make things better for everybody with a disability. When I started my journey, we had real champions in both the House and Senate who were either Democrats or Republicans, and they worked very closely together. And I think our task is to try to engage people of both parties to help us advance policies that are going to help people with disabilities live the lives that they want, that they choose what they want to do and how they live and with whom they live. And I think that's one of the most important challenges that we all face right now.
You said bipartisan. That means working together. Democratic and
right.
Republicans need to work together, and engagement means what?
So engagement really means working together. That and I think just that directly. The ADA became the law because Democrats and Republicans worked together, because people with disabilities and the business community worked together. Everybody worked together to shape the ADA. And everybody was able to see what was important to them in the ADA. And and I hope that, you know, right now things are very polarized, meaning people don't want to agree. And I think disability policy and the work that we do to make sure that our disability laws work is good for everybody. And it's our job to make sure that Democrats and Republicans can see that it's their job as well.
Thank you. And the last question, and I promise it will be the last question, is what do you think we need to focus on the most right now?
Sure. One of the things that's really important about you doing your show is you're helping to educate people about what's going on in Washington and how it can affect their lives. And I think one of the most important things that all of us can do is to try to help policymakers understand what happens when they make decisions that are either going to help people with disabilities or hurt people with disabilities. And it's our collective job to help them understand, right? We have to tell them what it means to be one of us and what it means to be independent and to be able to get on the bus and to be able to live in your own home with the person that you choose and to eat whatever it is that you want to eat for breakfast and to go to bed whenever you want to go to bed. All of those things can be what Congress does can either make those things easier or make them harder. But they may not know that. So unless we tell them, we can't get mad if they make the wrong decision. It's up to all of us. And it's why your show is so important as a way to get the word out to people so that they can help educate their friends, their neighbors, and people who make decisions about the services that they need to live their lives.
Thank you. And thank you for saying that about Tuesdays with Liz. Thank you, Katie, for your time, and I look forward to talking with you next month. Thanks again, Katie.
My pleasure. Thank you.
Bye.